What if I told you your teeth are secretly making you look older? Or you ever wonder why you don't look as young as you feel? You might be surprised to find out whether you're getting the most out of your precious smile. One of the first things people notice about you. Hello and welcome back. I'm Dr. John Yu, and today we're covering a fun and potentially life-changing topic: how bad teeth traits are adding years to your appearance. Now imagine looking more attractive, younger, and even more intelligent by just changing these 5 bad teeth traits. Research consistently shows that people with attractive, youthful smiles are perceived more positively, appearing more trustworthy, approachable, and confident. A beautiful smile can leave lasting impressions and set the tone for positive social interactions, professionally and personally. I'm sure you've experienced this yourself before. By addressing any of these 5 traits, you're not only looking more youthful and healthier, but also enjoying the psychological benefits of increased confidence and overall mental well-being. If you learned anything useful from this video, I really appreciate a thumbs up to help more people benefit from these insights. Stay tuned till the end because the last bad teeth trait has the most transformative capability. So you ready to learn? Let's dive into it. Trait number 1, yellow or stained teeth. If your teeth are starting to resemble your morning coffee, it might be time to consider some whitening options. But why do we care about yellow teeth? Yellow or stained teeth can make you look older because they're often associated with aging and poor oral hygiene. As we age, the enamel on the outer surface begins to wear and thin down, revealing the yellowish dentin underneath. In addition, stains accumulate over time. Stains from coffee, red wine, tea, certain colored foods, giving it a more aged appearance. So, very simply, bright white teeth are typically associated with youth and vitality. So maintaining a whiter smile can help you look immediately younger and more vibrant. What can you do to whiten your teeth? Let's start with number 1, over-the-counter whitening products. There are whitening toothpastes, there are whitening gels, there are whitening strips. I'm not even going to talk about the whitening toothpaste. They don't actually do that much. Whitening strips can help lighten surface stains. Look specifically for products with the ADA seal of acceptance. These products are formulated to gently bleach the teeth, lifting surface stains and restoring some brightness to your smile. However, they're not effective for deep stains, and it may take a while for you to see results. This may be a great starting point for people who want to try whitening. For teenagers, I often stay conservative about my treatments for teenagers, for kids. For those who are just getting started with whitening, this may be a great entry point. It's cost effective and there's low risk. Now, what if you've already done that and you want to get better, faster results? You should consider professional whitening. In-office treatments like Zoom or opalescence, the 2 that we carry in our office, can significantly brighten your smile in just 1 session. During these procedures, a high concentration bleaching agent is applied to your teeth with a gum barrier carefully placed to protect your soft tissues, such as your gums. In-office whitening can make your teeth several shades whiter in about an hour. So if you got a hot date coming up or you have an important event, this might be your go-to. Also, for people who don't want to go through the routine of strips or what I'm going to be talking about next, this may be an appropriate option for you. Now let's move on to number 3. At-home whitening kits are sort of the in-between of over-the-counter and professional whitening. You're going to need 2 things for this. Number 1, custom-fitted trays from your dentist that fit perfectly onto your teeth, and professional higher grade whitening gel. This is higher grade than the stuff that you're gonna get over the counter because you have a custom fitted tray to hold the gel and to minimize contact with your gums. Why do we care about your gums when we're whitening? We wanna avoid bleaching your gums. Another good tip is using these trays after your professional whitening session can help preserve your white smile for longer. So you'll often see offices offer the at-home whitening kit either for free or as an added service to help you achieve that white smile for longer. Let's move on to trait number 2, worn down teeth. If your teeth are getting worn down and they're starting to lose their original shape, it's time to consider what we call restorative options, or putting it back together. Why do we care about worn down teeth? Isn't it just a natural progression of life? In some ways it is. I'm not talking about the little wear and tear that you might get on your enamel. I'm talking about losing your anatomy of your tooth. If your tooth has nice, beautiful cusps, the mountains that make the tooth what it looks like, and they're flat, those are pretty noticeable. It can also change the way that you bite, and it can also change the status of your tooth. If you're wearing away enamel, you're wearing away protection, you have more likelihood of sensitivity. It's not just an aesthetic issue, it's actually a health concern. So what sorts of things make you wear down your teeth faster? Certain habits like bruxism, teeth grinding, wear your teeth away a lot faster than normal usage. So what are some solutions if you're grinding or your teeth have just worn down over time? Let's talk first about custom-made night guards. Custom night guards are made from a mold of your teeth, ensuring a perfect fit and providing a barrier between your upper and your lower teeth. This prevents further wear and can also alleviate jaw pain associated with grinding. However, it does require some getting used to, so don't give up if you've just started it. It can be a game changer for your precious teeth. The one thing that's better than treating the symptoms is to treat the source of bruxism itself. What is causing your teeth grinding? Is it your girlfriend? Is it your boyfriend? Is it your work stress? Is it your sleep patterns? Are you overstimulated with your caffeine? There could be a number of reasons. Yes, it may be hard to identify what exactly it is, but it's worth trying to look into it. With my teenage and adult patients alike, I always emphasize the importance of stress management. Stress management techniques might include mindfulness, better sleep habits, simply reducing your stimulants like caffeine. When done correctly, it's amazing how much stress reduction can improve both dental health and overall well-being. Solution number 3, restorative treatments. Dental crowns, fillings, veneers. Keep in mind, these are treatments and they're not to be taken lightly. I never want to see any of you fly to a different country and get 10 veneers and crowns just because you saw a TikTok deal for $99 each, okay? These are invasive, irreversible procedures, and they're not only for cosmetics, but when done with a proper diagnosis, treatment plan, and informed consent, these transformations can be life-changing. Trait number 3, making you look older, gum recession. If your gums are receding, it's important to address this issue not only from an appearance standpoint, but from a health standpoint. How does receding gums make you look older? Think of it as receding hairline. As your gums pull back, your tooth looks longer, and older people have this more often. So again, you associate receding gums with age. Gum recession can also be caused by periodontal disease, which is more common in older age groups. It can also be caused by aggressive brushing, incorrect brushing, the wrong brush type, bruxism, certain habits, and even genetics. So what are some solutions to slow down receding gums, to prevent it, or to treat it? Let's dive in. Let's start with the lowest hanging fruit. And this is something that I talk about with my patients every single day. Proper oral hygiene. This is something that you have full control over. You need to use a soft or extra soft bristled toothbrush. Don't use medium or hard. Also use gentle, proper brushing techniques. The type of toothbrush you're using matters as well. And I'll talk about that in just a second. For those who have periodontal disease or they have calculus under their gum line, so scaling and root planing, or SRP for short, is a deep cleaning attacking the buildup underneath your gum line. When you have buildup such as tartar or calculus, that's the hardened plaque, sitting underneath the gum line, your gums and your bone can actually both recede. That's not a good thing. So the deep cleaning addresses the buildup. It's your job to floss. Again, have proper oral hygiene to prevent this thing from happening regularly. So you've heard this before, you have to floss every day. Whether that's with a string floss or a floss pick, it needs to get underneath the gum line so that there's no buildup occurring below the gums. Now let's say that your gum recession has gotten to a point where it needs to be treated. Gum grafting requires taking tissue from another part of your mouth, such as the palate, and patching it onto your receded gum. For patients with severe gum recession, this procedure is life-changing. You go from having very sensitive, long teeth with roots exposed to the environment to having normal looking and not sensitive teeth. So props out there to all the dentists, periodontists, surgeons who are doing the grafts and the pinhole technique and all that fun stuff. All my respect. The absolute best way to address both gum recession and buildup is to prevent it. And it all starts at home with a proper oral hygiene routine. The question is, are you optimized with your equipment? This is the Life N Wave, the electric toothbrush I helped design with the team at Life N from a dentist's point of view to address the very common concerns that we had just talked about in this video. The Life N Wave features dual-action 60-degree oscillation and vibration technology, which aligns with the dentist's recommended bass brushing technique. This wider oscillation range also ensures thorough cleaning, even in those hard-to-reach areas. In addition, the customizable app allows you to change oscillation speed, range, and vibration strength across 10 different levels. This is important as most electric toothbrushes are far too abrasive and their intensities are still too high for your gums. You can rest assured that this electric toothbrush was designed with you in mind. Use the link in the description. Thanks to my team at Life N. Now let's move on to the last 2 teeth traits. Trait number 4, making you look older. Missing tooth or missing teeth. Now I'm not just talking about the ones in the aesthetic region where you can see them, but also the ones that are hidden in the back. But why would missing teeth in the back make you look older? The National Institute of Dental and Craniofacial Research points out that missing teeth, even in the back, can lead to bone loss, teeth shifting, and changes in facial structure. You might notice that in older age groups, as more and more teeth are missing, bone shrinks, they get sunken areas of the face. These small changes in your facial structure can be prevented by keeping your teeth healthy. So what are our solutions for missing tooth or missing teeth? Let's start with number one, dental implants. You've probably heard of implants, which involves placing a titanium screw into your jawbone or your maxilla, allowing it to osseointegrate, which means integrate into your bone. And once it's stable enough, placing a crown on top of it. You can think of it as a functional prosthetic arm, but it's your tooth. So it is a fake body part, but it's functional. And what it does is it helps preserve the jawbone in the area. It was one of the most breakthrough moments in dentistry, and I'm sure many people out there are very thankful for it. Number two, dental bridges and dentures. For the sake of this video, they are prosthetic teeth, fake teeth that span certain areas. This can be a cost-effective way to replace one tooth or multiple teeth. I want to point out that not every patient is a candidate for dental implants, which make other options more viable. Fun fact, did you know George Washington's famous wooden teeth were actually made from ivory, human teeth, and metal? So dentistry has come a long way. Your dentures are not made with your neighbor's old extracted teeth. No matter how much you love your neighbor, I'm sure you're thankful for that also. All right, and trait number 5. This is a really big one. Crooked or misaligned teeth. And fixing this might be the single greatest investment you make in your health, your aesthetics, and your well-being. And I'm not just talking about it from an aesthetic standpoint. Functionally speaking, when you have malocclusion or an incorrect bite, you have a deep bite, you have excess overjet, you have a cross bite, crowding that's leading to periodontal issues. All of these things can contribute to oral health issues later. And these sorts of things can age you faster. If you had a bad knee and you kept walking on it and you just said, I don't care, nobody sees my knee. Over time, your knee will wear away faster and you will possibly develop a limp. Many orthodontists out there are actually passionate about fixing your functional issues first. The aesthetics is actually the easy part. I saved this one for last because it covers this overarching message that if you respect, preserve, and fine-tune your health, it's not only going to help you physically, appearance-wise, but it can help with your health in all aspects. All right, let's go quickly through the solutions. You got traditional braces, which are the metal braces. There are also clear aligners, which are more discreet solutions to orthodontic treatment. I mentioned these 5 bad teeth traits not to make you feel self-conscious, but to use this information to empower yourself. Many underestimate the power of a transformative smile. And as someone who's seen firsthand patients who come back happier, healthier, and glowing, I wanted to share some things that you might want to consider if you want to unleash the power of your smile. If you haven't joined already, my new Instagram broadcast channel, Longevity Protocol, can be joined for free. I'm going to be sharing all my health hacks, daily health challenges. Join me as we go on this adventure together, constantly improve a little bit each day. All right, so link is in the description for that. We'll see you in the next episode.